I am about to have oral surgery tomorrow for 4 dental implants, and I just wanted to post a little video about my experience. I have a unique experience. I've actually had 4 extraction sites reopened for dental implants. When I was in high school, I had braces, and that orthodontist told me I needed to have 4 teeth pulled. And then, so he did that. He had that done. He had me go to the dentist and get them pulled. And then he pushed all my teeth backwards to close the spaces and tilted them in. And for years, I was very unhappy with the pushed in, tilted in teeth. I had like a recessed mouth and made my nose and chin stick out and look bigger. And then like 20 years later, I got braces again, and I wore those for about 6 or 7 years, and the spaces were completely reopened. And then now I'm ready to get the implants in finally, so my journey is almost at an end. So here are the teeth that are missing on top and bottom this side. Same thing on the other side. And I've been wearing a retainer with fake teeth in it for a couple years. Oh, jeez. So here I am with the fake teeth in. And I'm kind of nervous. The doctor I'm going to has like 25 to 30 reviews on Yelp and Google, and every single review has 5 stars. So that's kind of unbelievable to me. I know he's a professor at a college, so and you know, he just has rave reviews, and I went to see him for the consultation, of course, and he seems really great. He just put me right at ease and just seemed great, so hopefully this will go well. I'm thinking I might need IV sedation. I'm not sure. I didn't think I would, but now I might. And this doctor said I would need grafts in each tooth. I'm guessing that he just wants to do that to be safe, because I've had another periodontist tell me that he doesn't know if I need grafts or not. I was seeing a different periodontist the whole time I was in braces, so that he could keep checking the space width to see if they were wide enough for implants. But I'm not going to go with that doctor, and I'll explain in more detail about that situation in a different video. But for this one, I'm just talking about preparing for surgery, and this is like a huge moment for me, because ever since those years that I've hated my teeth, finally I'm undoing what was done. Those 4 teeth were wrongly pulled. That orthodontist at the time, he told me that if you held a pencil here between your nose and chin, and if your lips touched the pencil, then my teeth were not far back enough. I had an overbite. I sucked my thumb, but it wasn't severe. It wasn't that bad, you know. I mean, I could stick my pinky between my top and bottom teeth, but I have my impressions. I have my models of my teeth from before I've ever had any braces, and I showed them to my orthodontist, and he said you should have not had 4 teeth pulled. And other orthodontists have said that too, that I wasn't a candidate for extraction. But they told me that's what they did in those days. They followed the Tweed method. I guess there was a Dr. Tweed who thought that no matter what was wrong with your teeth, you had too many teeth and they would need to be pulled. But anyway, I'm just undoing what was done, and I'm really glad about it. So hopefully this doctor is good, like everybody says. And he didn't write all those reviews himself. Just kidding. But I will post another video too after surgery to let you know how it went. And also, I have a lot more details to my journey because it's been going on. I had my first braces in 1985, 84 or 85. And the second braces in like the year 2005. And they were just taken off 2011 or 12. And it is now 2016. So it's been a very long journey. I've actually had braces on 4 times. The first time was in high school for 2 years. The second time was with an orthodontist that I couldn't stay with because I moved. So I only had those braces on for like 6 months or something. And then the third time, they were on for 6 years with a different doctor. And then he couldn't he got the spaces opened, but he couldn't straighten the rest of the teeth. Like he would fix one side and then the other side would do something weird and he'd have to correct that. And then when he corrected that, something else happened. It was like, you know, he had cleats glued on the inside of my teeth, on the teeth adjacent to the extraction site, because they would turn as the expanders were pushing them out. I just had a lot of stuff going on, and I'll talk more about it in detail. Anyway, the fourth orthodontist, the final one, is the one who, I'm out of breath for some reason. I don't know why. He finished it up. He took a year, and he corrected all those little tweaks, the teeth that were just a little bit off, and he did some other things to make my teeth look better. Fix the angle. That's something else I'm going to talk about. And that's it. So I will be getting back to you guys soon. Thank you for watching. Bye-bye.